All right, I wanted to share with you an idea of where AI is going to hit on healthcare and some of the things that I think are real and some that are emerging and interesting. All right. Um, in terms of, first of all, this notion of why generative AI is huge because we can all speak to it in our own language. The idea of where it's going to hit with the WINS framework, which you are familiar with, and some basics around the idea to tell folks that this is really about unlocking your superpowers through power tools and its impact on organizations and markets is real. As we think about AI in medicine, there's a long history of AI in medicine. Mycin, an expert system created back in 1975 that did blood disease diagnosis, and so it was one of the early things back in symbolic AI. I was on the board of a company called Amicus. We did AI to do diagnosis and also discharge notes and ERs and other areas. Why would AI be huge in medicine? Really obvious things. Low productivity in healthcare, lots of advanced technology, yet a lot of the improvements haven't been seen in terms of that increasing productivity. Massive growth of spend. And the question is, AI a magic bullet or just magic here? I think it's particularly useful, AI and generative AI is particularly useful for healthcare because it combines deterministic models on, complicated areas, as well as probabilistic Gen AI models. So we can take unstructured data, semi-structured data, and bring it to bear in a reasonable way. In order to think about this, I want to offer you this idea of DAISY, which is an acronym in terms of 5 areas: diagnosis, administration, innovation, supply of capability, and you as the areas that will hit. First of all, help and diagnosis. It's been very clear that in differential diagnosis, especially in things like pathology and radiology, that AI can help. There's a big study done by Google, reported in Nature, looked at over 29,000 images. There's a 5.7% improvement in false positives, better in terms of getting that correct, and 9.4% improvement in false negatives of the machine against the human in breast cancer diagnosis. Administration. One of our folks at the conference we had talked about Andy talked about the fact that they had deployed generative AI to take a doctor's visit from 14 minutes with 4 minutes with a patient and 10 minutes on administration down to 7 minutes. But in that 7 minutes, they actually spent 50% more time with the patient, 6 minutes with the patient, and only 1 minute on administration. So that's 100% improvement in doctor productivity, while a 50% increase in time with patient. And the AMA has shown repeatedly that administration is an area that doctors are really having a tough time with. Another area is on innovation, the I part of in the I part of DAISY, we're seeing improvement over on the right-hand side here. There's been over 950 FDA AI approved devices since 2017. This one over here is using AI to use retinopathy and AI imaging and analysis to improve the ability to diagnose diabetes with severe diabetes through retinal scans. And in addition, and I'm going to get to this in a minute, there's over 1.2 billion people on Aadhaar, which is a system that they use in India to use iris scans and biometrics to identify individual citizens so that they have a digital ID. In addition, you have innovation with drugs, discovery, in silico prediction of efficacy, subject recruitment and submission. In terms of the S part, you have GV, which is a massive new launch, which I've mentioned before. This is something that launched on August 15th, Indian Independence Day. It's a differential diagnosis tool that is available on phones. And right now, their aim is to go to 3 billion users. They've had about 5,000 already using this. They're reviewing the data. This would be the ability to have a dock in a box, if you will, in a smartphone. And a key investor in this has ambulances within 20 minutes of over 920 million people in India. So if it works, it's going to have huge distribution. And then individuals. 1 in 3 Americans are using some kind of wearable, whether it's the strap when you go to the gym to check out your heart rate or the Aura ring. And we're going to move to a model where people are going to be able to have differential diagnosis and capability in their own hands. So my predictions here are that there'll be diagnosis in highly computable areas like radiology. Administration will be big. Innovation for drug discovery because the dollars are worth it to them. There'll be supply, not in the US, but in emerging markets, will have doc in a box. And I think that the top third of folks will, in the US anyway, will continue to grow and have other innovations around these wearables that they're using. So in terms of impact of AI on medicine and healthcare, I think it's going to be diagnosis, administration, innovation, supply, and you. And that is my prediction.